Hello and welcome to Rajya Sabha Television. You're watching COVID-19 India Fights Back with me, Rausan, Pereira. Well, people who have recovered from the novel coronavirus infection may need only one shot as opposed to the recommended two jabs if they are taking the Moderna or Pfizer COVID-19 vaccines, according to a study which suggests ways to minimize doses when supplies are limited. In a study posted on Monday, researchers found that people who had previously been infected with the virus reported fatigue, headache, chills, fever, and muscle and joint pain after the first shot more frequently than those who had never been infected. COVID survivors also had far higher antibody levels after both the first and second doses of the vaccine. Based on these results, the researchers say people who have had COVID-19 may need only one shot. The yet-to-be peer-reviewed study posted in the reprint repository medR14 assessed the antibody responses in 109 individuals with and without documented pre-existing immunity to the novel coronavirus. In this edition of COVID-19 India Fights Back, we will analyze the vaccine dosing approaches and different kinds of vaccines that are available. Joining me on the program today are Professor Narendra Kumar Arora, Chairman, COVID-19 Working Group of NTAGI, Professor N.K. Ganguly, former Director General, Indian Council of Medical Research, and Professor Sunil Raina, Head, Community Medicine, Dr. R.P. Government Medical College, Himachal Pradesh. Thank you to my guests for joining me on this edition of COVID-19 India Fights Back. All right, Professor Ganguly, let me begin the program with you first. Let's try and understand the details that have come out as far as this research is concerned, where it suggests that someone who already has been infected by the COVID-19 disease does not have to take two vaccines, but is two shots of the vaccine rather, but one shot is enough. Of course, these are just initial findings, but could there be something there?
Actually, this is nothing surprising. This is the tenet of basic immunology, that when a person is naive and an injection is given, the T cells and the immunologic cells get trained, and then you get the second dose after an optimal time and you get a booster. However, if you already had so initially the COVID was a very new virus, the basic antibody titer in the population was not there. So everyone was almost a naive population. Data started pouring in, and in that data, there was an issue in which we saw few indicators. Firstly, that there were antibodies which protected. This is AstraZeneca new data, that it even after the first one, it protected almost 60% even after one injection, and it prevented transmission in 67%. And Johnson & Johnson is a one shot vaccine. It protects around 62% after one shot only. However, second shot is needed to give a booster. If you really want to get a very long-term antibody response, second shot is desirable. The whole issue started, the dosing thing, with the Pfizer data, that if you had the first dose low and the second dose high, you get a better immune response. And then in the United States, when you couldn't give the vaccine to the arm of the people because of lot of logistics and lack of vaccine, they said that, okay, give the first one and it will protect about 60-70% people with the Pfizer and Moderna, and that is enough. That will stop the transmission. If there is 70% thing and you immunize most of the people, and then you give the second dose at an appropriate time, it will have the same effect. And in the UK, where also there was a vaccine shortage, the AstraZeneca vaccine, which went first, they stated that you can give the vaccine even after 2 months. Even then it will be okay. These were data generated on the side, and still the data is being generated. Like the Johnson with a one-shot vaccine, their side data there where they are giving two shots. But one of the things which happens, which is happening, it has happened in one of the studies in which I am also involved in Medanta. We are taking samples before vaccination and after vaccination. Those people, persons who had antibodies before vaccination or who had infection, when they received the first jab, they had more reactions than those who didn't have, and those who received second jab in these, they had much higher reaction. One of the things which happens in these viruses, like this one, dengue as well as respiratory syncytial virus, that there are disease enhancing antibodies which also appear. So this appears after 10 to 11 days, sometimes during the infection period. This happens in certain type of individuals. Here the AD has been tested before approval. However, the real in-depth testing has not happened. So this is at this given moment, if you have a huge infection rate in your country, where you are not able to do stop transmission, death is very high, and you are having nasty viruses, and no, at this particular juncture, you can do with immunizing as many people as possible and could do with the one jab, and later on you could give the second jab.
Right.
However, there is a problem is this nasty viruses, that Brazilian strain and the South African strain as well as the Danish strain. These strains are not getting neutralized that efficiently with the current vaccines. This
Sure.
data is now available. So for a country like India, where we do not have that much problem of transmission at this given moment, what I will do, that I will recommend that you take the second dose also, so
Okay.
that we have little long lasting immune responses, and some of the symptoms which are coming, they could
Hmm.
be minimized. The symptoms are body ache at the side, fever, and pain in the joint. These are the most of the system, and allergy.
Okay.
So if you take paracetamol or compounds like that before and go on taking for one more day, you will be okay. Your symptoms will be minimized. But in our country, since the transmission is not that big, and at the moment, according to our plan, vaccine supplies are available. According to
Hmm.
our plan, we do not have enough vaccine supply, I must say. But according to our plan, we have enough available. I will recommend that we take a second jab also.
Okay. Professor Arora, since we are here, then let's talk about it from the Indian perspective. The findings of this particular research, can that be useful for us here in India as well? And, can the same logic follow here too, where those who have already been infected with the virus may not need two shots?
Thank you very much, Frank, for inviting me to this important discussion. I will continue where Professor Ganguly stopped. That it is well known immunological principle. If somebody is exposed to virus and then a vaccine is given, the response is good, and one may not need multiple jabs after that. However, there are one or two observations from India. One, that in one of the very important studies where plasma was taken from those who were RT-PCR positive and administered to patients with severe COVID infection. And it was seen later on that almost one third of them had not developed adequate antibodies. So, in the Indian setting, whatever we are seeing, some of them may not have adequate antibodies, although they may have another type of immune response, which is not easy to measure, and that is T cell response. The second important thing is that when we look at the various sero surveys, in this country, almost 25% or one fourth of the Indian population has been exposed. And most of these infections are asymptomatic. As we know, today we have around 1 crore plus patients reported so far. But there is another almost 20-25 crore people who are infected, but they never had any symptoms. So in a programmatic setting, it becomes very difficult who got the infection and who did not get the infection. The second issue is that, as I said, that we are also not sure how many antibodies, how many of them have developed antibodies after the infection. And the third thing is that India is in a very fortunate situation. We are not vaccine deficient in that sense. We have a supply line prepared for ourselves so that the country has adequate sample. And even if we give an additional dose to those with RT-PCR, it is not going to make too much of a difference as far as our total requirement is concerned. So in the context of these 3 or 4 points, the national program also, when the program is rolled out, there are operational issues. And then when you start looking for some of these additionalities, it becomes more complicated. So the current guidance is that anybody and everybody who comes, irrespective of previous exposure to the virus or previous RT-PCR positivity, everybody is expected to get the full schedule of the vaccine. Currently, we have 2 vaccines. Both of them require 2 doses, whether it is Covishield or Covaxin. But tomorrow, as Professor Ganguly said, that we have a vaccine which single dose, we will give single dose. Or if we have a vaccine which requires 3 doses, DNA vaccine from Cadila requires 3 doses, then 3 doses will be given. So whatever is the recommended schedule, the current program strategy is to continue with the scheduled doses as given by the manufacturer. I'll stop at that.
Absolutely. All right. Professor Sunil Raina, let me come across to you now. Since we are here, one obvious question is that if someone who is already infected with the virus takes all the required and prescribed doses, does that person mean that he has a greater immunity and may have higher chances of not contracting the virus again? That is one. Secondly, if a person who is positive and has taken both the doses, is there a chance of getting some kind of an adverse impact at some point in time?
First, thanks for inviting me to this important discussion. And second, to be in the company of somebody who has worked very well on vaccines. Dr. Arora has worked a lot on vaccines and particularly on childhood vaccines. So it's very humbling an experience to be in his company to talk about vaccines. But as far as I'm concerned, we need to see vaccines in 2 contexts. One, vaccines have always been known to protect individuals. So they have an individual feel, in the sense that an individual who gets vaccinated will be protected from a disease. But vaccines are also known to protect populations. When we vaccinate a number of people, that population gets immune to an infection and is able to prevent transmission of infection to somebody who has not been vaccinated. So what does that mean? That means that most of the vaccines have to be rolled out in the form of a program or implemented in the form of a program. So if you look at Indian setups, Indian settings, most of the times the vaccination that we follow, the childhood vaccination, they are rolled out in the form of a program, the universal immunization program. So if you are planning to vaccinate Indians, the huge number of Indians, you have to have a vaccine policy in place, and that vaccine policy will be implemented through a program. And that program will have to have clear-cut concept, whether we need a single dose or whether we need 2 doses. So at this point in time, as Dr. Ganguly and Dr. Arora rightly pointed it out, we have the 2-dose regime and we should follow it up. Now, as regards your question, whether having 2 doses with somebody who has been infected, will that be an adverse event or will that help the patient? As far as we are concerned, we feel that giving somebody 2 doses of vaccination and who has been previously infected with the virus won't make much of a difference. It will help the patient only. It will boost the immune system and will be of help to the patients. It won't have any adverse effects to the patient as such, somebody who has been infected with the virus. Because at this point in time, we are really not sure what will happen with the vaccination schedule that we have in place. With the second dose, after a second dose, how long will the immunity last? Will it last 8 months? Will it last 12 months? Will it last more than that? So we are not very sure about the time after the second dose for which an immunity enough to protect occurrence of infection will last. That is something we have still not been able to gauge. because most of the studies are in the preliminary phase, and a good number of studies are in a preprint phase. They have not been, they have not gone through the peer review process. So we are still not known. It's still not known to us as to what exactly will happen to the immune status of individuals who are vaccinated. So at this point, it is always advantageous go with the 2-dose schedule and see how exactly we span out in future for the rest of the population.
All right, all right. So let's take the discussion forward now, and on the note that Professor Raina was making, I would like to take that particular aspect up with you, Professor Ganguly. In all likelihood, is it safe to assume the kind of vaccines that we have right now all over the world as far as COVID-19 is concerned will most likely be like the flu vaccines that we already have and will have to be taken, almost on a yearly basis?
Yeah, actually, most respiratory infections, except measles, which is not pure respiratory infection, which has a lifelong immunity, most other respiratory infections are yearly vaccinations. Influenza virus is a little different than COVID. That influenza virus changes much more, mutations happen much more. It also incubates in various hosts. And every year WHO or every 2 years WHO provides a guidance according to the surveillance data, and you have to take an yearly vaccine there. And normally vaccine time is before the cycle starts, so people are protected, and old and the younger children are protected there. COVID vaccine, although is mutating and has mutated, and now the mutations are causing worry. As I talked about three mutated strains which are causing worry, there are 7-8 more. In India, we don't do that kind of sequencing, so Indian mutations severity we do not have not gauged at the moment, but it is going to mutate. At the moment, with all the modeling which we have done, because we haven't followed it up to that period, as Dr. Raina said, whatever modeling we have done, it looks like that it will last at least for 6 months. T-cell immune responses last more, but through modeling, it looks like it will last 6 months. The vaccine companies have already started work on that. Pfizer is making a third generation vaccine where messenger RNAs can be tweaked. So it is making vaccines according to the mutations. It is synthesized very quickly tweaked. There are some other platforms like Novavax, etc. vaccines, which can also be tweaked very quickly. So all of the companies now are taking note of the mutations and have started tweaking and creating the next generation vaccine. So by the time we go to that particular stage, we will have more vaccines and the same vaccines in a new avatar. Right. At that time, we should have a good regulatory process. And in that good regulatory process, we should be able to quickly move it through. It should not go through the entire spectrum. But one of the things which we are learning gradually and slowly, because we didn't go through all our emergency authorization, we didn't go through complete authorization. We are learning more and more about the adverse reactions, because long-term adverse reactions were not known. And when you go to a larger population with different ethnicities, different genetic composition, etc., you find people reacting differently. Right. So that particular experience will be very valuable experience, and we should create system where we catch every adverse events and should encourage people to talk about that and record and then do in-depth studies to see if there are populations which are significant enough which are showing those adverse reactions. Some of them may not be related, which we are recording at this time, but many of them may be related. So this will be a challenge. Finally, I will stop with this particular assertion that different nations have different responses and policies based on their own experiences. USA is going through a horrendous period of time. Right. there the major emphasis there is that put vaccine in the arm of as many people as possible as quickly as possible. So they have their priorities have gone. You anyone who goes, they can get a vaccine. Even in another state, they can go to another state and they can get vaccine.
Right.
Europe is struggling with a severe vaccine shortage. So since they have a severe vaccine shortage and a supply thing, they are going through another route. They are going through that maybe we can give second dose later and let us immunize as many people as possible so the economy and travel etc opens up. So
Right.
all these experiences will be very vital experiences. We should note that and move accordingly. I will, Frank, I will take leave from you.
Sure.
I
I understand that you
and
have to be elsewhere. Professor Ganguly, thank you for joining us on the program and sharing your views. Let me take the discussion forward now with the other panelists. So, Professor Arora, let me come across to you. Since we are here, let's also talk about the various different types of vaccines that we have for COVID at the moment. And, how are they different from each other?
So, Frank, if you allow me just to elaborate on the safety aspect of the vaccine,
Please
that
do.
India has set up a very elaborate system to document vaccine safety. So every day we know by the end of the day how many vaccines have been administered or how many people have been given vaccines. But simultaneously, there is a system in the COVID to document what adverse effects or events have occurred with those who have received the vaccine. And there is a national AEFI committee which is looking at very closely on a rolling basis. And events like death or hospitalization, causality assessment is being done. So I would like to assure our viewers and the country that the system is very sensitive, that we should not we should have a very, very safe vaccine into the system. And I must also say that Indian vaccines are having less symptoms as compared to Moderna and Pfizer vaccine. The local reaction is almost 1/3 of what is being seen in the Western system. Now, coming to the type of vaccines, we have 6 platforms. One platform is the one where Covaxin was produced, and that is an inactivated vaccine. It's a full virus, but inactivated, and that is provided to us. Second, that a vector is used. That means another virus is used. You introduce a segment of the COVID virus into that, which is important for protection. And this virus is then introduced as a vaccine into the other system. So this is called vectored virus. And there are several of these. And Covishield is a very good example of that. Third one is a DNA vaccine, and Cadila is producing, where DNA, a DNA structure is prepared which expresses the antigen of the COVID virus. Fourth one is a RNA virus. See, Pfizer and Moderna are also RNA viruses. And we have in India, Genova is a company which is coming up with a RNA virus, but there is a difference. The RNA virus in India is something which is self-replicating. So with a much lower dose is required, and once you inject, you are likely to have a much better response. So, but we have to see, it is still in the early clinical phase. Fifth type is which is called subunit vaccine. That components of the vaccine are taken. You produce them in large quantities, put them together along with an adjuvant, and you inject it, just like hepatitis B vaccine. So there are this kind of vaccine which are coming up, and very soon we will have 2 or 3 such vaccines, both from Serum as well as Bharat Biotech and other vaccines. There is another very interesting vaccine which is coming up, is called nasal vaccine. This is one of the few vaccines in the world which is coming up. It is in phase 3 now, and this is also has entered into clinical trial. So you give a single dose of nasal drop, and that is sufficient. And so that is broadly the various types of vaccines which we are going to have. And we expect that by the end of this year, we will have 6, 7, or 8 vaccines for emergency use authorization.
Absolutely. So, as very nicely elaborated by Professor Arora, Professor Raina, we have a nice spectrum, a wide spectrum of vaccines that are available ahead of us, and we may get a few more added to that list as well. Is there a particular vaccine or vaccine type that, is better or holds the edge over the other?
As I said, when we run vaccination in a program mode, it's always better to have a basket. So if you have a good number of vaccines in your hand, so you can choose from one of them. How does that help? That helps us in one way, because when you want to approach a large population, number of manufacturers, when they are in high number, so they are able to give you more number of vaccines. The supply chain is established there. So having more vaccines in your basket is going to help us. At this point in time, we don't really have a choice to choose as to which is the best of the two, or which is the best of the next 5 that are going to come to us. So anybody who has been vaccinated, for example, with a Covishield now or a Covaxin at this point in time, he or she is expected to receive the same dose as a second dose, same vaccine as a second dose. So the choices go out at this point in time. Maybe once we move ahead and have a number of vaccines with us, we may be able to decide on which is better for us. But at this point in time, I would advise people, I would like to inform people that stick to what is available at this point in time. And as Dr. Arora pointed out very clearly, very elaborately, that they are very safe. There are not very serious side effects as compared to the ones that are available in the Western world. These are very good vaccines, and side effects are to the minimal. So take them and don't be hesitant in taking vaccines. Second thing that I just wanted to add to what Dr. Arora already said previously, and Dr. Ganguly was also of the opinion. Now, most of these studies which you talked about in your initial part, now most of these studies have been conducted in the Western world and are limited to 2 vaccines only, and they have been conducted on a very small sample size. Now, extrapolating them to a larger population or to Indian context will not be correct. So we just need to read it with a pinch of salt. We may not have to follow what they are saying at this point in time. India, as such, has huge data. If you look at data and then want to extrapolate that data for the entire world, that is acceptable. Because as such, Indian data can be extrapolated to the world because the numbers are huge. So we don't need to extrapolate the data that has been derived from small countries with numbers of 109, 110 and then use it in Indian context. But instead of that, we can pick up the data from Indian settings, use it to our advantage, and extrapolate it to the entire world and tell them this is how vaccination policies, vaccination programs, and vaccines work in different settings. So at this point in time, the 2 vaccines are good enough for us. We should take them and stick to them. Don't have to think about, let me get a Pfizer vaccine at this point in time, let me get a Moderna vaccine, let me import it, let me purchase it, let me do something else. So at this point in time, I would say no to that. Take what is being offered to us.
And very quickly, Professor Arora, I've got 30 seconds left on the program. Your quick closing concluding remarks on the best way forward.
So I would like to tell my viewers and everybody that we should be proud as Indians. We are a leader in vaccine manufacture today and even vaccination process. And we need to be independently framing our own policies. Whatever our systems have been made very robust, whether it is safety, whether it is effectiveness, I think we should have trust and faith on our scientists, and the way vaccine policy is derived here, we need to follow that. So with that, I would like to conclude.
All right. On that note, then, I'll call it a wrap on this edition of COVID-19 India Fights Back. Thank you to my guests for joining me on the program and putting things into perspective for us. As I leave, Rajya Sabha TV would like to make an appeal to all its viewers to stay safe from the COVID-19 pandemic. Remember to wear a mask and wash your hands and face regularly. Follow physical distancing whenever you're stepping outside. These small steps can go a long way in combating the COVID-19 virus. With that, it's a wrap. See you again next time.